The doctors treating you will have recommended a course of chemotherapy for up to 16 weeks to try and reduce the size of the cancer or to stop it from growing. We've already heard that doctors are developing what's called targeted therapy for cancer, so that patients only receive those treatments most likely to be useful to them. The main aim of FOCUS4 is to find out if some of the newer drugs that have been developed are any better, worse, or just the same as if you didn't have any drug treatment. We also need to see if laboratory tests really do pick out which types of bowel cancer have the best chance of responding to different drugs, to allow us to be a bit more specific or to tailor treatment. This is rather like making sure that if you have an infection, the right antibiotic is prescribed. If you wish to consider joining FOCUS4, then there are 2 stages, the first step of which is called registration. Registration involves sending a piece or a biopsy of your bowel cancer to a central laboratory for testing. When you were first diagnosed, this sample might have already been taken and stored at your hospital. If not, then you'll need to have a biopsy taken. At the central laboratory, scientists will examine the biopsy and look at the cancer cells for changes to the genes. This can take several weeks. Sometimes abnormal genes cannot be identified for various reasons, and so the bowel cancer is described as unclassified or non-stratified. If this happens, you'll still be able to join part of the trial called FOCUS4N, and I'll explain that in a bit more detail later. Halfway through your course of chemotherapy, you'll have a CT scan. If this shows that the cancer has grown, you'll no longer be in FOCUS4, and your doctor will explain the best way to continue treating you. Let's listen to Professor Morn explain a bit more about this registration stage and the tests that might be done on the biopsy samples.
So when somebody comes to the clinic, first of all, they've been found to have bowel cancer that's spread to other parts of the body. We talk to them about FOCUS4 and offer them entry to register within FOCUS4. So this is the registration phase. And in the registration phase, what we're offering and explaining is that if we can have access to the biopsy or the sample that was taken from their cancer, so that we can do extra tests on it, that would help us then to get the right treatment tailored to that individual's cancer later on. So that's the registration phase. It's about access to the sample. Then patients go through their first 4 months or so of conventional chemotherapy. And at the end of that time is when the second phase comes. And that's the time when we will give details from the analysis that's been done in the lab that will enable us to allocate which trial is relevant for that individual. And then the patient will be offered randomization, that is entry into the specific trial that's suitable for them. So that's the second phase, randomization phase.
So, if the CT scan at the end of your course of chemotherapy shows that the cancer has shrunk or not grown any bigger, then your doctor will discuss the results from the tests and which part of FOCUS4 might be on offer for you. Please remember that even if you consent to registration, you don't have to continue with the second step of FOCUS4. This too is entirely voluntary. However, if you do choose to continue, then there are 2 options that may be offered. As I've said before, the FOCUS4 trial has several studies or molecular trials within it. If you have a type of bowel cancer in which the tests have identified changes to the genes, then the first option is to join one of these molecular trials examining a new drug for that particular gene mutation. The other option is to join FOCUS4N. Once you've decided whether or not to join the second step of FOCUS4 and the doctor has discussed which of the options are open to you, the next stage is called randomization.